Most guys think prostatitis is something you just have to live with. Annoying pain down there, weak flow, zero energy in the bedroom. But what if I told you in most cases it's completely fixable? Not with just pills, but with movement, smarter habits, and a few things your doctor probably never mentioned. Let's fix it the smart way. Today we're going deep into what prostatitis actually is, why some guys feel awful while others have no clue they even have it, and how to finally get relief without spending your life in a pharmacy. By the end of this video, you'll know the real symptoms and what's not prostatitis, how to treat chronic inflammation naturally, what to do daily to keep it from coming back. Let's go. I'm Dr. Max, board-certified urologist with over 10 years helping men fix issues like prostatitis, BPH, and low testosterone. And I've got a message for every guy over 35. Prostatitis is not a life sentence. Most of the time, it's caused by two things. First, blood flow problems. And second, inflammation that never fully clears. Today, I'll walk you through what works, based on real science and real patients. Let's bust a myth first. Not every pain or bedroom problem means you've got prostatitis. That occasional twinge in the groin or a one-time weak erection. Probably not it. That happens to all of us. But if you're noticing a pattern symptoms that hang around, then listen up. Here's what chronic prostatitis actually feels like: a dull ache between the testicles and the anus. Often the first and most stubborn sign of chronic prostatitis, caused by inflammation or pressure on the pelvic nerves. It's not sharp pain, but a constant heavy discomfort that wears you down over time. Pressure or pain in the lower belly, lower back, or penis tip. This often means your prostate is inflamed or swollen, putting pressure on nearby nerves and organs. It can feel like deep tension or soreness that shifts around, especially when sitting or after urination. A weak or faded orgasm feels like something's missing. This can happen when inflammation disrupts the nerves and muscles around the prostate, which play a key role in orgasm intensity. You still finish, but it feels dull, less satisfying, and leaves you wondering, was that it? Strange burning or irritation in the urethra. This can feel like a mild stinging or raw sensation during or after urination. It's often caused by inflammation around the prostate pressing on the urethra, and it's one of the most common, but often ignored, signs of chronic prostatitis. Frequent peeing, especially without a full bladder. This often means your prostate is inflamed or swollen, pressing on the bladder and irritating the nerves. Even a small amount of urine can trigger the urge, making you feel like you have to go, even when there's barely anything there. Fatigue, brain fog, or just feeling off. This isn't just in your head. Chronic inflammation from prostatitis can mess with your nervous system and drain your energy. When your body's constantly fighting low-grade inflammation, you're left feeling sluggish, unfocused, and just not yourself. But let's talk about when things really flare up. Here's how acute prostatitis or a serious flare feels. Sudden fever, chills, or muscle aches like you've caught the flu out of nowhere. Sharp, intense pain in your lower back, pelvis, or between the testicles and anus. Burning or difficulty peeing that hits fast. And that I've been hit by a truck feeling that knocks you flat. If that sounds like you, don't wait. You need to see a doctor. That could be a bacterial infection, and it needs treatment fast. Quick gut check. How many of those symptoms sound familiar? Drop a comment below if you've ever been told it's probably just age and deep down, you knew something wasn't right. You're not alone, and you're not imagining it. So here's what's really going on under the hood. Most guys assume prostatitis means I've got an infection. But chronic prostatitis? It's usually not about bacteria. It's about two things. First, stagnant blood flow in your pelvic area. Second, low-grade inflammation that just never goes away. Sure, infections like chlamydia or gonorrhea can cause a sudden, painful flare-up. But the long-term, nagging kind? It's often triggered by everyday stuff like sitting for hours without moving, poor circulation from lack of exercise, a weak immune system, cold exposure, especially your feet or lower back. Now here's the catch. Antibiotics don't fix any of that. They might help temporarily, but they don't solve the real problem. That's why so many guys take pills, feel a little better, and then boom, symptoms come back. You can't pill your way out of a lifestyle problem. If your prostate's inflamed because it's not getting enough oxygen, blood flow, and immune support, no amount of medication will fix that long term. So far, you've learned what prostatitis actually feels like, why it's usually not about infection, and why blood flow and body movement matter way more than just popping pills. Now let's get into what actually helps. And no, it's not some miracle cure. It's simple stuff most guys never get told. Here's what I tell my patients, and I'll tell you too, you've got to move. Because movement isn't optional, it's medicine. Especially when it comes to your prostate. When blood sits still, inflammation builds. But when you move, you pump in fresh oxygen, nutrients, and immune support right where it's needed. Here's the daily plan that actually works. Start with these 4 simple exercises every day. Slow squats, 10 to 15 reps, controlled and steady. Glute bridges, 2 sets of 10. Focus on form. Knees to chest holds, 30 seconds each leg. Gentle, no bouncing. Deep hip stretches like butterfly pose or pigeon pose. Loosen the hips, release the pressure. These target your pelvic blood flow, and that's the key to healing and preventing flare-ups. Next, stay active throughout the day. Walk at least 30 minutes a day. Not a stroll, a real walk, wide stride, arms moving. You're pushing blood down into the pelvis and flushing out inflammation. Desk job? Set a timer. Every hour, stand up. Move for 2 or 3 minutes. Doesn't have to be fancy. Just get out of the chair and reset your circulation. This stuff may seem simple, but it works. And in chronic prostatitis, consistency beats intensity. But I don't have an infection. You say, exactly. That's the whole point. Most men with chronic prostatitis don't have an infection. The burning, the pressure, that weird irritation, it's often not from bacteria at all. It's from inflammation and poor blood flow, what we call pelvic congestion or stagnation. And antibiotics? They don't fix that. They can help temporarily if you've got an active infection. But if the real problem is poor circulation and chronic low-grade inflammation, no pill in the world is going to solve it for good. What you need is a plan that addresses the root cause. Here's what I give my patients, and it works when you stay consistent. Do the 4 core exercises every day. Walk at least 30 minutes, wide stride, good pace. Cut back on caffeine, alcohol, sugar, and cold exposure, especially your feet. Support your immune system. Aloe vera, Bepalin, or ginseng if cleared by your doctor. Adjust your chair, better yet, switch to an ergonomic one that reduces pressure in the pelvis. If symptoms flare, talk to your doctor about anti-inflammatory support, not just antibiotics. None of this is complicated, but it works because it's based on how the body actually heals. Let's be honest, most of us aren't riding horses or working on farms anymore. We're stuck in cars, at desks, or behind screens all day. That's what's killing pelvic circulation. And that's what's fueling this whole problem. So even your chair matters. That's why we now recommend split-seat ergonomic chairs, designed to take pressure off your perineum and improve blood flow to the prostate. I tested one myself, and I'll be honest, I didn't expect much. But by the end of the week, no more numbness, no soreness, and I could feel the difference. It's not magic. It's smart design, and it's one more tool in your corner. If this video helped you understand your symptoms and gave you a plan to take back control, then do 3 quick things before you go. Hit like, it tells the algorithm this video matters. Subscribe so you don't miss what's coming next. And check out the next video, where I walk you through the exact habits and supplements that support long-term prostate health. Because listen, you don't have to live with discomfort. You don't have to guess, suffer, or settle. You can fix this, one smart step at a time. I'm Dr. Max. Take care of your health, and I'll see you in the next one.